There is a vitamin sitting in millions of American medicine cabinets that most people over 60 take every single day, and it is quietly causing damage their doctor has not told them about. Not because their doctor does not care, but because most doctors never check for this. By the time the damage shows up, in the kidneys, in the blood vessels, in the heart, it has been building for years. If you are taking a calcium supplement, a multivitamin, a bone health formula, or a vitamin D tablet right now, what I am about to share is exactly why you clicked on this. My name is Dr. Mae Jemison. I am an internal medicine specialist with a focus on preventive care for adults over 60. I have spent more than 28 years managing heart disease, kidney disease, diabetes, and osteoporosis, often all in the same patient. What I have learned in that time is something most patients never hear until the damage is done. Stay with me. What I am about to share is what I tell my patients in the office, information most people never hear before it is too late. Here is what most people do not understand about the body after 60. When you are younger, the system has a wide margin of error. A little too much of something and the body handles it quietly. But after 60, that margin shrinks. The kidneys slow down. The arteries stiffen. What the body used to flush out easily, it now stores or deposits in places that cause real harm over time. Think of the plumbing in an older house. New pipes handle pressure without a problem, but after 40 or 50 years, those pipes have built up narrower, less forgiving. Eventually something gives. That is what happens with certain vitamins after 60. The vitamin I am talking about is not obscure. It is one of the most purchased, most trusted supplements in this country. I am talking about vitamin D. Specifically, what happens when people over 60 take too much of it, which based on what I see every week is far more common than anyone says out loud. Almost every patient walking in with a vitamin D supplement tells me the same thing. Doctor, I take it because my bones need it. My last doctor said my levels were low. And look, there is truth in that. The National Institutes of Health has confirmed that low vitamin D is associated with bone loss and fall risk. So where does it go wrong? It goes wrong in the dose, and it goes wrong because of what vitamin D actually does inside the body, which most people taking it have never been told. Vitamin D is not like vitamin C. Vitamin C is water-soluble. Your body flushes out whatever it does not need. Vitamin D is fat-soluble. It does not get flushed, it gets stored in your fat tissue, in your liver, and it keeps accumulating with every pill you take. Vitamin D's main job is to increase calcium absorption from food. It tells your intestines absorb more calcium. When you are taking too much, that signal gets turned up louder than your body was designed to handle. Think of the thermostat in your home. Vitamin D is the dial. Calcium absorption is the temperature. A little heat is what you need, but if someone cranks that dial up and locks it, the house overheats. Things malfunction. That is what excess vitamin D does after 60, and the consequences ripple through the kidneys, the arteries, and the heart. The first sign almost nobody connects to their vitamin D supplement is unexplained fatigue and mental fog. Most patients tell me, I have been tired for months, I am just not as sharp. And because those symptoms are so common after 60, they get dismissed. But here is what that belief misses. When vitamin D levels rise too high, calcium builds up in the blood, a condition called hypercalcemia. The kidneys go into overdrive trying to clear the excess, pulling water from your body in the process. That causes a kind of chronic mild dehydration that does not feel like thirst. It feels like exhaustion. It feels like fog. According to the American Kidney Fund, kidney stones and early kidney damage are significantly more common in adults taking high-dose vitamin D without monitoring. Millions of people are blaming their fatigue on aging, when it is actually their morning supplement. Your habit from this point. If you take vitamin D and feel unusually tired or foggy, ask your doctor specifically for both your vitamin D level and your serum calcium, not one without the other. Both. Pause here. Are you currently taking a vitamin D supplement, whether one your doctor recommended or one inside a multivitamin? Go to the comments and type yes, just that word. I read every comment, every one. The second sign gets blamed on almost everything except the real cause. Increased thirst, more frequent bathroom trips, and a dull lower backache that comes and goes. Most patients chalk this up to salt, getting older, or sitting too long. But when calcium accumulates in the kidneys at levels higher than they can manage, those deposits begin forming crystals, the early stage of kidney stones. Before a stone is large enough to cause serious pain, it causes exactly these symptoms. The body is running on emergency mode. According to research cited by the Mayo Clinic, vitamin D toxicity. even at doses many supplements consider standard, can cause early kidney damage that shows no symptoms until significant function is already lost. Like a slow leak in the foundation of a house, you do not feel it happening, but the structure is being compromised underneath. Your habit here: check the vitamin D dose on every supplement you take. Anything above 4,000 IU per day for a person over 60 without medical supervision warrants a conversation with your doctor. Write the number down. Now I want to tell you about a patient before we go further. Her name was Dorothy, 67 years old, a retired librarian from outside Columbus, Ohio. She read the labels, exercised, cooked at home, one of the most conscientious patients I have ever treated. She took a high-dose vitamin D3 tablet every morning that a previous doctor had recommended 2 years earlier. When she came to see me, she was not in crisis. She said, "Doctor, I just feel wrong. Energy down, concentration off, muscle weakness in her legs." Her vitamin D level came back more than 3 times the upper safe limit. Calcium elevated. Kidneys showing early strain. 2 full years of faithful daily supplementation with nobody ever rechecking her levels. Dorothy is doing well now. Her energy returned within 3 months of adjusting the dose, but she said something I have never forgotten. She said, "I trusted that pill completely. I never once thought it could be hurting me." That is exactly what I need you to hear. If you have a parent, a sibling, a spouse, or a close friend over 60 who takes a vitamin D supplement, save this video and send it to them when we are done. They may be in Dorothy's exact situation and have no idea. The third area is the one I find most alarming. It involves the cardiovascular system. When calcium is circulating at levels higher than the body can use, it does not just go to the bones, it deposits in the walls of your arteries. This is called vascular calcification. The American Heart Association identifies arterial calcification as one of the most significant contributors to cardiovascular risk in adults over 60. It stiffens arterial walls, raises blood pressure, and increases heart attack and stroke risk. Think of a garden hose in winter. Flexible when soft, water flows easily. When it gets brittle, far more pressure is needed to move the same water through. The pump wears out. Research through the National Institutes of Health confirms that adults with chronically elevated vitamin D and elevated blood calcium have measurably higher rates of arterial stiffness and heart muscle thickening. Your habit here: if you take vitamin D and your blood pressure has been creeping up over the past year or two, those 2 facts belong in the same conversation with your doctor. A home blood pressure cuff used every morning before supplements gives you data no annual checkup can match. I want to stop here and speak to you directly. If you recognized yourself in any of what I just described, the fatigue, the back discomfort, the rising blood pressure, do not minimize it. Do not chalk it up to age. Age is not a diagnosis, it is an assumption, and that assumption is where the real danger lives. The fourth area is one most people never connect to: a vitamin: mood, sleep, and cognitive clarity. When calcium is elevated in the blood for extended periods, it disrupts how nerve cells communicate. The nervous system runs on electrical signals regulated by a delicate mineral balance. When that balance is off, mood suffers, sleep becomes difficult, anxiety rises. And in older adults, the cognitive effects can mimic early dementia: confusion, memory lapses, difficulty concentrating. The CDC identifies mood changes and cognitive symptoms from hypercalcemia as among the most underreported and most frequently misattributed symptoms in adults over 65. Doctors reach for depression diagnoses, families worry about memory loss, and the cause is still on the bathroom counter every morning. Your habit here: if you or someone you love over 60 has had a noticeable shift in mood, sleep, or memory in the past year, and takes vitamin D, that timeline is worth examining with a physician who will run a complete metabolic panel, including calcium and vitamin D25OH levels. Think of someone right now, a neighbor, a friend, a family member, who has been feeling more anxious, not sleeping well, getting more forgetful. Someone probably taking a multivitamin without thinking twice. That person needs to see this. The fifth point is what every person over 60 deserves to hear clearly. Many calcium supplements now include vitamin D built in, calcium plus D3, marketed as a complete bone health solution. But if you take that product, and also a separate vitamin D, and also a multivitamin that contains vitamin D, you are stacking doses, 2 or 3 times what you think you are taking, without knowing it. According to the Harvard T.H. Chan School of Public Health, A significant percentage of adults over 60 in the United States are unknowingly exceeding the safe upper intake level for vitamin D, not from recklessness, but from combining multiple products. The National Academy of Medicine sets the upper limit for adults over 70 at 4,000 IU per day. One supplement may have 2,000 IU, a multivitamin adds 1,000 more, a calcium plus D tablet adds another 400 to 800. Stack those together and you are past the limit before breakfast is over. Your action here: take out every supplement you take each morning, lay them on the kitchen table, add up the vitamin D number from each label. 5 minutes. That is all it takes to know where you stand. I want to be honest with you for a moment, not as someone making a video, as a doctor. I have had patients sit across from me who did everything right by the conventional wisdom of their time. They exercised, took their vitamins, followed the advice they were given, and they still ended up in my office with kidneys straining, arteries stiffening, and symptoms they had lived with for years that nobody had connected to a cause, because nobody had looked. The gap was not complicated. It was a vitamin, trusted, recommended, every day, taken at the wrong dose, in the wrong combination, without monitoring. Most of the damage I have seen in patients over 60 did not come from bad luck alone, it came from missing information. You now have it. Here is the summary. Excess vitamin D after 60 causes fatigue and mental fog through elevated blood calcium. It causes thirst, frequent urination, and lower back discomfort as the kidneys try to manage the overload. It stiffens arteries and raises cardiovascular risk through calcium deposits in vessel walls. It disrupts mood, sleep, and cognitive clarity by throwing off nerve cell mineral balance. And the hidden stacking problem: multiple supplements combining past safe limits may be happening right now without your awareness. Your action plan: add up the total vitamin D in every supplement you take. If you have not had a vitamin D and calcium blood test in the past year, call and ask for both. If you have been experiencing fatigue, back discomfort, or mood changes, connect them to your supplements at your next appointment. And share this with one person over 60 who takes vitamins without thinking about the dose. The patients who caught this in time did not have better genetics or better luck. They paid attention to what their body was telling them, and they asked the right question at the right time. That is the only difference I have ever found. If this video gave you something useful, share it. Think of one specific person right now. A husband, a wife, a parent, a sibling, a close friend over 60 who takes a daily supplement without thinking twice about what is in it. Send this to them. That one action may matter more than you know. Tell me in the comments which of these 5 signs have you noticed in yourself or in someone you love. I read every single comment, every one. Next week I am going to walk you through the exact blood tests every adult over 60 should be asking for, the ones not included in a standard annual checkup, and what the numbers actually mean in plain English. Hit subscribe and turn on the bell now, because if today was useful, next week is going to matter even more. Before I go, everything I shared today is general medical information based on published research and my clinical experience. It does not replace your personal medical care. Before making changes, especially to supplements or medications, please talk to your own doctor. They know your history, they know your body, and that